Hi friends, we are thinking about coughs in this episode. We know that if we have a cough, it will automatically go away in 2 or 3 days. Or if we drink a cup of coffee or take some medicine, it will go away. But some types of coughs, some people have coughs that do not go away for years or coughs that last for months. Many people are suffering because of this. So when I thought about coughs, when I looked at the patients I have treated, we had to treat 10 or 15 different types of coughs during this treatment period. So if we put everything together into one episode, it would be a long episode. That is why I want to talk about coughs related to fever. The fever has gone, but the cough has not gone. Or we are talking about such coughs in this episode. After that, in other episodes, coughs related to allergies, or some people say coughs that only come when they lie down, or coughs that only come at night. Or some people have asked that sometimes coughs come after eating, coughs that come after taking a bath, coughs that come after catching a cold, and so on. There are many types of coughs related to gas. So in this episode, we will talk about coughs related to I am thinking about fever, and after that we still have a cough. I want to tell you first about how to understand it. I am Dr. Anumod Kakkassery, Marine Ayurveda Thrissur. As I said in the beginning, if we have a cough, we know that if we drink a cup of coffee or add pepper to it and drink it, we can control our diet for 2 or 3 days. To a certain extent, we can survive the cough. Powders like Tari and Adichu Unam are available in the market. If we eat them, we can get rid of the cough. Some conditions have a cough that does not change. I remember an experience like this. When I was working in a dispensary, I needed a woman for housework. Then a person there said that a woman is ready and willing to come. But there is only one thing, there is a cough. I will come after it changes. So I waited for this person for a month and thought that the cough will go away. Even after a month, their cough did not go away. Even after 2 months, their cough did not go away. So I decided that there was no point in waiting anymore. I thought about going to his house and seeing him, and after going home, I realized that the person first had a fever and then this cough. Now there is no fever, only a cough. Ayurveda says that if we get a fever once, if we do not treat it properly, it will remain in our body as a cough. So what actually happened was that fever, since it did not get proper treatment, it moved to the lungs and became a cough. Therefore, what we need to treat is the fever. So what did I do to that person? I gave him the same old fever as the symptoms of the fever. In this way, after giving the proper treatment for that fever, the woman's cough completely disappeared and it was possible to escape. So the first point that can be understood from this is that even if the fever does not completely disappear, it can continue as a cough. The second thing I have often seen in patients is that when we have a lot of fever, many people take many antibiotics or many other medicines, even if they are Ayurvedic medicines. Sometimes when we take many medicines, this acidity can develop and after a while it turns into a cough. This acidity alone has been done by many people. We have only treated acidity, then the fever came and then the fever went away, but the medicines taken for fever create acidity in the stomach. Only after treating this acidity did the cough go away. Therefore, when we say treat acidity, it is not just a treatment that takes an antacid, it has its own levels. We need to understand it in different ways. So often we have treated cough, we have managed acidity there. Similarly, another type of cough is called lung infection, and with it comes fever. Infection and fever change to some extent. But once a person came to us with a cough, they have been coughing for a year or two, and they have been coughing a little bit, but for that, MRI or lung CT was done. After all this, we realized that the infection is still persisting in a small lobe, very small. No matter how much medicine they take, that medicine cannot reach that end of the lungs, so it turns into a cough. The reason why the infection is still there is the same. So there I use a method that we used. We gave medicines, we gave antibiotics to get rid of the infection. Ayurvedic medicines were given in the same way we did Gugulu, applications like smoking Google and inhaling its smoke. Ayurveda says that Google has a lot of antibiotic action. It is given to the lungs to breathe. When this smoke reaches the lungs are the most direct way to reach the lungs. This Google is able to reach the lungs more quickly than the medicine reaches the blood. Similarly, when it comes to everything related to COVID in this period, we can understand that the most persistent cough among those who have COVID is still coughing. Many people cannot breathe. They cough after talking for a little while. They cannot exercise like before. What is the special feature of COVID? We know that COVID virus is important, but the lungs depend on it. That's why such a big cough persists. COVID RT-PCR is negative, but nothing reaches the strength to take a breath in a normal health condition. This cough is persistent in them. So why is it happening? The lungs alveolus still has its infections virus. Even if the presence of this virus is RT-PCR negative, this presence is because the virus lungs are there. Even after coming here, this cough is still lingering in people. So what should be done there? There is only one thing to do there. What is the treatment for this COVID? Let's do it again in a stronger dose. That is exactly what we need to treat in such cases. As mentioned earlier, practices like using Googaloo and inhaling its smoke help quickly eliminate the viral infection from the lungs. So these, plus the COVID medicine, plus these types of smokes that act like antibiotics to cure the lungs, or even medicines taken internally, when it comes to the recent cough that many people are experiencing, there's really no need to ask whether they've had COVID before or not. Many people, just like a patient who came in yesterday, are experiencing collapse of a lobe of the lungs after COVID. By the time a CT scan was done, the lungs had already collapsed. It was concluded that the airway was blocked and that the cough would never go away. But with just this one intervention, we were able to make a significant difference. In just 5 days, we were able to completely turn around this patient's condition. So in this context, what can we actually do for patients, for individuals? When we talk about cough, Ayurveda says it originates from the stomach. It is related to the stomach, or rather it is connected to the digestive system. That's why for patients with cough, it's important to pay attention to their dietary habits. Now, even for those who have recovered from COVID, if they immediately switch to a heavy diet, especially if they start eating a lot of fish and eggs, the cough will worsen even if their COVID RT-PCR test is negative. So for a few days, what I recommend for Ayurvedic treatment is a 5-day plan. Even if you can manage just 5 days or at least 3 days, that's enough. If you can avoid things like fish and eggs for at least 3 days, eat light food and take Ayurvedic medicines, we can manage to get rid of this cough. It's a condition that can be completely cured. So we need to pay attention from our side as well. In this way, we should be careful to follow a diet that avoids as much oily and greasy food as possible, avoid boiled eggs, and also avoid watery foods, fish, and such items. Similarly, if we look at what we can do with single herbs, even if we don't get kukuru, we can use preparations made from kantakari. Kantakari, even at a small level, provides us with antibiotic and antiviral properties. Inhale it and see and check if there is any improvement. By consistently implementing these simple measures, even while staying at home, we can achieve a significant number of positive health improvements ourselves. Jan? In the next episode, we will carefully examine and discuss the various causes of coughs triggered by allergies, and the most effective ways that we should approach managing them. There are many types of coughs caused by allergies, some that occur only at night, and so on. In the next episode, we can discuss coughs caused by allergies. Let's meet again in another episode. Thank you.